Good morning. My question is for the Minister of Health. When this government was seeking a mandate from the people, it railed against, and I quote, the elites. It said and continues to say they are, and I quote, for the people. Well, just last month at a special council meeting of the City of Cambridge, the mayor and local city councillors in my city overruled their citizens and decided that they were going to go ahead with a drug injection site in the Galt downtown core. Before this government lost its courage, it went as far as threatening to use the notwithstanding clause to overrule Toronto City councillors who opposed a reduction in the number of municipal politicians. If this government is truly for the people, will it dig down deep, find some courage, and reject Cambridge City Council's application for a drug injection site against the will of Cambridge citizens?
Thank you. I recognize the Parliamentary Assistant to the Minister of Health.
Thank you very much, Mr. Speaker, and thank you to the member from Cambridge for the question. As you know, this government has come up with a policy for consumption and treatment sites across the province, and we've had 16 that have been approved so far. All of these sites are based on reaction from the community. One of the things they have to do is make sure that they are responding to the community needs. It's an important part that they are a good neighbour and they provide the services within that context. So we believe that our consumption and treatment site program is a good program for these sites and is enabling the sites to be set up, and the sites are saving lives, and that's the #1 priority, is to be there to save lives. Thank you.
Returning the member for Cambridge for a supplementary.
I know the government has been uncomfortable with opposition to a drug injection site from local residents in Cambridge since this government has committed to funding over 20 such sites across Ontario. The government stated in its application guide for such sites that community support is essential prior to a municipality applying for approval for a drug injection site. In Cambridge, the higher-ups on City Council conducted a survey, and the vast majority rejected either proposed location put forward. So, what did Cambridge City Council do? They went against the will of its citizens and picked a location for a drug injection site that wasn't even put forward to the community for consideration or feedback. This is clearly a violation of this provincial government's own rules that state community support must be obtained prior to an application. Will the government do the right thing and follow its own rules and its own application process when Cambridge City Council undemocratically submits its application for a drug injection site against the will of the community?
Thank you. A return to the Parliamentary Assistant for the Minister of Health.
Thank you very much, Mr. Speaker. Our government takes opioid use very seriously. It is a very serious issue in the province of Ontario. That's why we've approved the consumption and treatment sites that we have in communities that need them across the province. And these sites, as I said, are saving lives by preventing overdose-related deaths. And most people are very concerned about that, and they want these sites to be available to save those lives. But they also connect people to primary care, to treatment, to rehabilitation, and other health and social services, and that's the virtues of the model that we have put up. I think it's an excellent model. But to be clear, we are still looking at applications, and as part of our government's commitment to put $3.8 billion into mental health and addictions to make sure that the health services, the mental health services, are there for the people who need them, and for people who have addictions, that we have treatment, harm reduction, and everything available that they need so we can minimize the terrible toll that opioids are taking on our society.